FaceTite is a radiofrequency based device that uses energy to cause soft tissue to contract. And so it's a device we can use to help treat the lower jawline in the neck, particularly in patients that tend to be more in their late 30s, early 40s, who aren't quite candidates for facelifts at that point, but want some improvement in that location. You know, FaceTite is best for patients that have good elasticity to their skin. They don't have significant banding in the neck, and they have some extra fat in their lower jawline and neck. FaceTite is a little bit more involved than SoftWave. SoftWave just heats the tissue externally, but with FaceTite you can actually dissolve some of the fat internally, and you generally do a little bit of liposuction for that dissolved fat, and the energy causes the tissue to contract down by about 30 to 35%. So this is the handpiece we use when we do FaceTite, and the probe goes underneath the skin, and then this part stays on the top of the skin, so it heats the tissue up in between. And it's that energy that goes from deep to superficial that liquefies fat. It causes these vertical bands to contract down, and it causes the skin to contract down. And so that's where you really see the benefit in this device. This is a video of the procedure itself. So we numb up the face and the neck, and then the probe goes from here to here, and it heats the tissue up in between, and it causes that tissue to contract down. And when you do it, you hear almost like a crackle sensation. It's like an analogy when you cook bacon, that tissue contracts down and you see the size of the bacon get smaller in the pan, and that's effectively what it's doing for the soft tissue in the face. You know, I usually tell patients that it takes about 3 months to see about 75% of the result, and a year to see the final result. So it takes some time. It is a controlled thermal injury, and so that tissue has to remodel and contract down. So you do see a difference right away, but it takes a long time for that tissue to fully contract down.